Mr. Chairman, ladies and gentlemen, I would like to present our presentation today about the possibility of cochlear implant non-user and how to predict it. As we all know, this is the WHO World Disability Report that 38 million people in the East Mediterranean region suffering from different degrees of hearing loss. And we have in Egypt here a deafness account of 3.5%. As we have our gathering today to celebrate the cochlear implant, which is the invention of the century for treating a profound and severe to profound sensorineural hearing loss. There is a long list of factors that play a role in post-operative outcomes, and this long list should be fulfilled in prediction the possibility of having a good and reliable use of cochlear implant. This is the issue of patient compliance is very important and very crucial in continuation of use of the cochlear implant. In our study here, we are using the term non-regular and regular user. And the non-regular user, it's the one that less than 5 hours per day in this study. In a retrospective cross-sectional review study, we started our work, and this is a part of a master degree thesis in Cairo University Hospital and in the period between 2014 and 2017. We have 232 patients implanted during that period, and we have a long list of inclusion criteria to fulfill the criteria of the study. 195 patients were included in our study out of the 232 patients, and we have a careful analysis of the pre-operative data and the intraoperative data, contacting the patients and their relatives, and taking in account the pediatric and non-pediatric group, and having a follow-up for the non-regular users to sort out some of the non-regular use causes. Also, a post-operative data further analyzed for any variable presented between the patients. Our results, we have a total of 178 patients, pediatric. The regular use was 156, accounts for 87%, and non-regular uses at 22%. In a non-pediatric age group, this group contained 17 patients. They were all regular users of their cochlear implant device. The cochlear implant system used in the study, we have a majority of MED-EL devices, 159 patients, and 36 advanced bionic devices. And the sound processor used is Opus 2, Harmony, Naida, and Sonnet. Aided pure tone response post-operatively for the whole study group, and this is denoting an on average of 38, 39 decibel hearing level. And the difference between regular and non-regular uses regarding the aided response, we found that this difference is not significantly it's not a significant difference in the aided pure tone audiometry threshold, giving an objective measures to usefulness of implant device and providing that all the patients were experiencing similar hearing level, either user or non-user. Non-regular users, these were further divided into a non-user or a limited user. We have a 13 non-user and we have a 9 limited users. We put points of reasons for non-use. We have an internal electrode failure. It is in 4 patients, battery failure, device stolen, charger failure, patient passed away, and too much noise. We have a reason for limited use. It's a peer pressure and discomfort, a recurrent ear infection, and unsatisfactory results. So for non-regular use, this is a pie chart having the majority of the technical use and the unsatisfactory following this reason. In our discussion, we took in our account to compare our data with the one in literature. In our study, we have a 12% were non-regular use, excluding the technical difficulties. We have only 6% if we exclude the technical difference. Main reason for non-regular use, again, it's a technical, peer pressure, and discomfort. In a discussion with the literature, we have Ray et al. 2006, 2.9% having a non-regular use because of lack of benefit and peer pressure. Rain et al. 2008, 7.1% non-regular use. Arshwood et al. 2009, we have 83% regular use and 17 non-regular use because of alternative communication skill like sign language preceding of fluctuant pattern of use followed by a non-use. Discussion also showed that Putelman and Kaplan, 3.5% a non-regular use, all of them were implanted when they were more than 10 years old. Ozdemir et al., 2013, 2.9 non-regular use because of multiple psychological and neurological problems. Marnan and Ching, 2005, we're having a 12% non-regular use, and the reason was a greater, for the regular use, a better hearing, a high maternal education, and an excellent socioeconomic standard. Emond et al. 2013, on a 6 non-user with sequential CI, categorized the reason of non-use into 4 items: appearance, expectation, sound quality, and motivation. In non-pediatric age group, we found Zolan et al., all 12 regular use, Rain et al. 2006, 2.7% non-irregular use because of the tinnitus and depression and non-auditory stimulation and a lot of background noise. Also, Summerfield and Marshall 2000, they're having a 6% after 47 years of implantation and 11% after 7 years of implantation. Rain et al., 1% non-regular use, they reported that they had improved compliance due to improved selection criteria. Lamerer et al. 2018, 21% of non-regular use, lack of benefit from the device, reported fluctuant pattern before becoming non-user. Also in non-pediatric group, we have also BAT 2005, they're having 18% of one-time stoppage using the device, and this is because of technical problems. In my conclusion, the cochlear implant is very successful treatment for patients with profound hearing loss. Patient selection is important to achieve high compliance rate, aided pure tone response, neural response telemetry, and impedance score for user and non-regular users are very similar, which make them highly unlikely to affect the compliance of the patient. Most of the reason for non-use in our study is preventable and treatable. Most patients that become non-user go through a fluctuant pattern between regular use and limited use before becoming a non-user, making a follow-up and prompt action very important to maintain the success of the operation. In our recommendation, it is important to have a more follow-up for a larger scale and having a multi-center study and a follow-up and a good selection of the patient. Thank you very much.